This is an inside look at thumb arthritis.
Where you have the base of the thumb rubbing on a bone that we call the trapezium.
During that rubbing, the cartilage in the joint can wear away.
It sits right about here, and this is where patients will complain of pain and swelling. So it's very common, especially in women.
Orthopedic surgeon Dr. Sanj Kakar says nearly half of women over 70 years old may develop thumb arthritis, making for painful moments doing everyday chores and lifelong hobbies. Dr. Kakar says there are several options for alleviating the pain.
Initially, the treatment for it is a splint that goes around your thumb.
Topical anti-inflammatory medications and physical therapy are helpful for some patients. Steroid injections reduce pain too, although the effects can wear off over time. Dr. Kakar says surgery is a final option when a patient continues to experience debilitating symptoms.
The main surgery there is taking out that bone and then doing some form of suspension to prevent instability of that joint. Surgery, when indicated, usually works very well.
For the Mayo Clinic News Network, I'm Jeff Olson.